Nagat, I believe our connection with you is up and running. We couldn't hear you earlier. If I were to ask you, what is the best way for us to help the senior citizens who are around us? Say I have a neighbor who is elderly. She lives alone, but if I were to assist her in any kind of ways, without, of course, being physically around her, what would you say is the best way possible?
I would say to approach the elderly, you have to be quite specific to the elderly because every elderly person is quite different. And we need to check on them. There is no doubt about it. Whether it's a neighbor, whether it's your own family, whether it's your elderly friends, because I believe in intergenerational bonding. So I have been seeing a lot of older patients. A lot of them are like my friends only. Call, video chat would be better if they are tech savvy. The reason being messages and this kind can sometimes be obviously missed. These older people might be using a lot of landline, I feel. So I think landline should really come in. And what we need to ask them during this period is basically how are they coping with this additional stress? I mean, let them just let out. It's not probably we are going to say that this is what you need to do, but at least they need to have a let out where they tell us that how they are feeling, how they are coping with the stress. Do they have any sort of fear of what's going to happen? Then we need to encourage them to do things which can be done even social distancing as well. Like people who are not tech savvy, people have played board games. I mean, they should go into that. They should do puzzles. They should do pick up any hobbies which they can. If they're already doing meditation, yes, we need to try to advise them to do the same. We need to, as caregivers, or as you said, if you want to help somebody, facilitate maybe if they need any medical advice, then we need to help them to patch them up maybe through video or however we can. Then we need to sort of help them in errands. I mean, there can be a lot of elderly people, maybe an elderly couple where they were dependent totally on a caregiver. And that caregiver might not be able to come because of the lockdown. So we as a responsible person who knows that older person should help them in errands, maybe get them the groceries, try to help them, obviously, being socially more active. Then I would also say give them importance. Why? They have seen life. So we need to also try to maybe seek advice from them as an experienced person on how we should tackle it together. Because I feel we should always empower the elderly rather than only looking at them as a person who's going to be vulnerable and who's going to be susceptible to this particular period. Yes, we need to, as doctors, allay their fears, both medical as well as psychological, and always try to communicate. I would say communication is so very important, because sometimes what happens is we just sort of isolate in a very different way, and an older person who does not want to talk at all. In this particular time, we need to sort of try to push them a bit more because them being in touch obviously will make them mentally more stable and obviously will make us sleep better. That an older person who I cannot physically help, at least I'm helping them in doing stuff.
Absolutely. I think that's important. It's so important as part of assurance and reassurance is to also give somebody's issues importance and also, bring about a sense of self-respect and self-esteem. I think that is really helpful in inspiring confidence also in somebody who is perhaps feeling lonely at this point of time during social isolation. Dr. Prem, what about the elderly in care homes, in old age homes? Would you recommend at this point of time that perhaps if the family has the means and can actually do it, that they perhaps need to be pulled out of the homes, or would you recommend that they stay there? And in that situation, then how does one look out for them and ensure that that their mental health, besides other things, is also taken care of?
Yeah, I mean, in a current scenario, to actually pull out them from a care home might not be that easy. Purely because, I mean, as of now, yeah, there is a lockdown. The so-called means to do it will be quite difficult. The fact that they have been taken care by a lot of people there, and they are obviously happy. And there has been obviously a reason why they have been put in the care home for whatever reason. I mean, we're not going to delve into that. But the point is, I would say that if the current ecosystem in which the older person is happy and is okay, I would want them to be in that ecosystem. But as of that, I know with personal experience talking to certain care homes in Bombay, yes, the caregivers are very concerned that how the care is actually being taken care. I mean, is all the precautions being taken? Or hand hygiene being done? So although they want to be physically there, but they can't. But the questions that the caretaker, the primary person of the care home is getting is enormous. Like, what are the precautions? What are you doing about that? Because these are people who have been living in that particular care home for a while. So as far as their mental part is there, it was going on well. And people have been going, people entertain them. Even I have gone, I have presented there. But now suddenly what happens because of this so-called social distancing, nobody really might be going, might be actually, earlier when younger students from colleges used to go there, teach them art. So that sort of has become a bit of a problem as far as the mental aspect is concerned. And if they would obviously want to decide and take them home, then I would want the caregiver to be ready for all the care that has to be taken, because it's not easy. It's not easy uprooting an older person from a current system where it has been stable and then to get back to home where they might have been comfortable earlier. But then it's very difficult to say whether they'll be comfortable anymore. And we also need to take into consideration that the burden that will come suddenly on the caregiver per se, because they are not, to be very frank, nobody has been mentally prepared for the situation. We have just got into it where we are taking every day together and we are trying to address the mental as well as the physical part of the older person. What I would try to stress here clearly is, yes, mental part is huge. Mental part because of coronavirus as well. The fact that they get distressed that, oh my God, I belong to the vulnerable age group, so that is bad. But we need to make sure that they do not forget their diseases, because ultimately those diseases need to be continuously treated. They need to take their medications. They need to also think that those are the diseases which are important. But we need to take care of the mental part purely because there could be a point where the older person will just say, what am I going to live for? Everything is going to a toss. What am I actually looking forward to? Why should I take my medications anyway? So in such scenarios, we need to actually continue to motivate them. I would say, rather than, again coming back to the care home, rather than getting back home immediately, I would say more frequent video calls, more frequent assurances by the care home per se to the relatives that they're actually being taken care well and all the precautions are being taken, rather than just changing the ecosystem entirely, and it might end up creating a chaos either way.
Right, absolutely. I think I think, at least for people who are out there, if you have any senior citizens, any relatives who are currently in caregiving homes, it's perhaps the best if you leave them there right now. And like all the experts on our panel have been saying, communication is key. So please call, please stay in touch.